Saliva test for insulin, a game changer in metabolic health. Monitoring insulin levels in the blood, specifically elevated levels known as hyperinsulinemia, has long been recognized as a key marker of metabolic health. It can indicate the risk of serious conditions like type 2 diabetes, obesity, and heart disease. Now, researchers from UBC Okanagan have discovered a breakthrough: measuring insulin through saliva. This non-invasive method could make it easier than ever to assess metabolic risk. No needles or lab work required. Dr. Jonathan Little, a professor at UBC Okanagan's School of Health and Exercise Sciences, explains that this simple saliva test goes beyond convenience. It could detect early metabolic imbalances, long before symptoms develop. In their recent study, published in Applied Physiology, Nutrition, and Metabolism, 94 healthy individuals of varying body types participated. After fasting, they drank a standard meal replacement shake. Then, they gave saliva samples and had their blood sugar tested via a finger prick. The results were striking. People with obesity showed significantly higher insulin levels in their saliva than those with lower body weights, even though their blood glucose levels were nearly identical. This suggests saliva testing might reveal hidden insulin imbalances in people who otherwise seem healthy, potentially identifying pre-diabetic risk earlier than current methods. Dr. Little notes that insulin resistance and hyperinsulinemia can quietly develop 10 to 20 years before blood sugar levels start to rise. Spotting these issues early opens the door to preventive strategies, like lifestyle changes, before more serious conditions take root. Co-author Dr. Hossein Rafieh highlights another key finding: saliva insulin levels tracked closely with blood insulin throughout the day, especially after eating meals with different carbohydrate contents. This suggests saliva could help determine how strongly someone's insulin responds to food, offering insights into the severity of insulin resistance. Saliva samples were taken 30, 60, and 90 minutes after the shake. Interestingly, some lean participants showed large insulin spikes, despite having normal blood sugar levels. This means that even people without excess body weight may be at risk, and that saliva testing could catch it. The fact that some individuals with lower weight still had elevated insulin levels is fascinating, Dr. Rafieh says. It shows saliva testing might be a more precise way to assess risk than relying on weight or BMI alone. The study also explored how waist circumference, BMI, age, and sex relate to saliva insulin. Waist size turned out to be the strongest predictor, suggesting it may be a better indicator of metabolic health than overall weight or age. In conclusion, the researchers found that saliva insulin measurements could be more effective than traditional blood glucose tests in identifying early-stage metabolic dysfunction. This opens up exciting possibilities for non-invasive early detection and, ultimately, better prevention.